All right, President Trump and the First Lady have tested positive for coronavirus.
They are now both in quarantine at the White House after a late Twitter announcement. The president tweeted the news, writing, quote, "We will begin our quarantine and recovery process immediately. We will get through this together." In a statement, White House physician Sean Conley says both are doing well. All this comes just hours after the president confirmed to Fox News that one of his closest aides, Hope Hicks, tested positive for the coronavirus.
She tested positive, and I just went out with a test. I'll see what, because we spent a lot of time, and the First Lady just went out with a test also. So whether we quarantine or whether we have it, I don't know.
Hicks traveled to several events with the president this week, including the debate Tuesday and his rally in Minnesota on Wednesday. The president also attended a fundraiser in New Jersey yesterday, spending time in close contact with a number of supporters.
So how might the president's diagnosis affect his ability to lead the country and his run for re-election? That's a big question that I'm sure a lot of people want answers to this morning.
Yeah, and we're talking to ER doctor Angelique Campen with Providence St. Joseph Medical Center in Burbank. Good morning, doctor.
Good morning.
So can you tell us, does a positive test for coronavirus mean that the president and First Lady actually have COVID-19?
So a positive test definitely means that you're infected. There really aren't any false positives. So they do have it. How severely they will be affected is yet to be determined.
So what kind of treatment will they get if they are not showing any symptoms?
Well, if you're not having any symptoms, it's just observation. So as we know, there really is no treatment for this. There's no antibiotic or medication to make it go away. It's what we call supportive care. So it's really the key is maintaining the oxygen levels in your body. I'm certain that they are doing everything they can to maintain their immune system with supplements such as vitamin C, vitamin D, rest, but mostly it's just going to be observation for right now.
So we're hearing that Hope Hicks is starting to get some symptoms. They may not have symptoms right now, but could they be getting them in a few days? That's what we've heard has happened to a lot of people.
So the majority of people, if they're going to exhibit symptoms, exhibit them within 2 to 3 days after exposure. The severity of your illness has nothing to do with who you caught it from or how it affected them. The effect of the virus in your body is dependent on the risk factors of your own body.
Okay, so the president and First Lady, should they quarantine, and what kind of physical activity or restrictions are called for, even if they feel fine?
So it is their job now to do their part not to spread this virus. So they are going to need to quarantine from anyone else for the next 10 to 14 days. I'm certain, though, my concern is that we're going to see other people from the executive branch that are also going to test positive. If they have minimal symptoms, I don't feel this is going to affect their ability to function. About 40% of people show no symptoms, and in the general population, someone in his age range, about 10% end up getting hospitalized.
All right, doctor, thank you very much for joining us. We appreciate it and all of your expertise.